Hi, my name is Dr. Chidebele Constance Obichi, an assistant professor here at the Indiana University Northwest School of Nursing. I am here to present an aspect of the study conducted by my team, Dr. Ogbonnaya Omenka, assistant professor at Butler University, and Dr. Ukamaka Oruche, associate professor of psych mental health nursing and the director of global programs at Indiana University School of Nursing. Prior to the COVID-19 pandemic, there was growing concern around the well-being of minority healthcare workers due to the numerous challenges they experience in clinical practice and academia, and the need for increased efforts at addressing these challenges and sustaining the well-being of this population. It is well documented that minority healthcare workers experience hostility, distrust, devaluation, bullying, and racism at their places of work. This is in addition to issues of burnout, stress, anxiety, and depression that are prevalent among healthcare workers. These challenges appear during training in the healthcare professions as students experience exclusionary behaviors from peers. Then the challenges continue as minority healthcare workers transition into practice. These challenges have negative impact on minority healthcare worker retention and their willingness to seek career advancement opportunities or even join academia. The purpose of this study was to find out mental health and advocacy problems faced by minority healthcare workers as the COVID-19 pandemic raged. Survey data from a convenience sample of 74 adults was analyzed using SPSS. Most participants were born outside the US and were 18 years and above and worked on the front lines of COVID-19. Participants reported being born in Nigeria, Cameroon, Ghana, Kenya, Philippines, Haiti, Dominican Republic, Myanmar, and Jordan. However, 88.9% identified as Black, 6.2% as Asian, 3.7% as Hispanic, and 1.2% as Middle Eastern. Whereas 18.2% were aged 18 to 33 years, 67.1% were 34 to 57, and 14.6% were 58 years and above. They identified as registered nurses, nurse practitioners, physicians, pharmacists, medical and nursing assistants, dentists, and respiratory therapists. While 62.2% earned $100,000 and above, 13.4% earned $99,000 or less, 4.9% earned $60,000 or less, and 16.2% earned $30,000 or less. It is important to highlight here that this sample are high-income earners whose financial contribution to the U.S. economy is significant. Relationship status showed that 67% were married, 18.2% were single, and 14.6% were divorced, while 73.2% lived with family members like children, spouses, or partners, 20.7% lived alone, and 6.1% reported as other. Hence, majority faced supply chain issues, challenges in managing their household, maintaining intimacy with their spouses, and caring for family members who tested positive for COVID-19. It was impossible to remove the overwhelming burden of COVID-19 from this sample. Hence, participants maintained connections with other professionals via audio and video conferencing. These connections provided a supportive environment where minority healthcare workers could vent, learn, and share feelings with peers across the nation without fear of negative consequences. For self-care activities, prayer and family support time were mostly used. While 36% engaged in prayer, 29.7% engaged in family support time, 18.8% attended self-care seminars, and 13.3% attended support groups. Participants identified prayer as a positive coping strategy through which they found the stamina and inner strength to keep up with the COVID-19 situation. In this study, participants were unable to use their powers of influence and communication to advocate for themselves. Hence, participants purchased PPE out of pocket, were denied time off, and lacked knowledge on assessing resources. We know that the squeaky wheel gets the oil. Therefore, it is not always the case that minority healthcare workers are passive and have communication problems. Not speaking up may be related to the fact that self-advocacy is not likely seen as self-care. It could be that cultural life experiences that tend towards problem solver rather than process driven. It could also be fear and concerns about consequences such as retaliation and loss of job. And it could be lack of confidence and the appropriate language for advocacy. The question we want to ask here is there a need for advocacy? And if yes, how do we build capacity among this population so that they feel safe and confident to advocate for policy and when issues of utmost importance arise? Here are some statements made by participants. I felt like I was asked to do things that can be done by other co-workers because I'm a minority and they care less if I get infected with COVID. My supervisor was more concerned about my productivity than my safety. I was the only provider not given a day during the week which patients were managed remotely. Received threats to be sent home from supervisor if business as usual was not continued. Our study revealed that participants were similar and comparable in some experiences with their majority counterparts. Common issues included floating to units with high acuity with little or no training, lacking knowledge and skills to care for COVID-19 patients, and stigma related to caring for patients with COVID-19. It is laudable that some participants received foods at work from their employers and that some organizations provided useful information and updates. However, identifying challenges provide opportunities for stakeholders to improve the well-being of this population. Here are some recommendations. Organizations should implement a psychologically safe environment where this population can openly discuss vulnerability and stress. Organizations should encourage minority healthcare workers to report cases of violence and other barriers to their well-being and apply measures for immediate follow-up. Organizations should adopt the zero tolerance to workplace violence policy and take appropriate action for the safety of all employees. I want to thank IUN for making this celebration of faculty research possible, and to my audience, thank you for listening.